I am a school teacher. I taught for 26 years. Prior to going on a 39-month disability leave, I had good health and I had accumulated close to 800 hours of illness time. When my school in April 2015 upgraded their Wi-Fi system, putting in over 190 access points in the school, 2 in every classroom, bringing in Chromebooks, bringing students with their cell phones, smart boards. All of these devices were radiating microwave radiation, similar to if you put 5G on street poles and you put them outside 2-story, they're at 2-story levels at bedroom levels. I became very sick, and so did several teachers at my school. Some teachers had to leave. My principal actually wrote to the Inspector General of my school district, and we were suffering basically what is called microwave sickness, also known as electrosensitivity. Symptoms such as headaches, nausea, skin burning, swelling in the nostrils, swollen glands, blurry vision. To my knowledge, parents were not notified of this, just like if your school has an epidemic of lice, a letter goes home. Parents were not notified. Nurses were not trained to recognize symptoms of microwave sickness. Doctors are not trained in medical school to know about this. Similar, I would say, to things like fibromyalgia, chronic fatigue, where people first didn't realize there really was something to it. I went on a 39-month disability leave. I ate through my close to 800 hours of illness time. I'm now earning half my income. I loved what I did for a living. It was my calling, being a teacher. And my quality of life has really been affected by this. I no longer have the freedom to just do everything and enjoy everything because there are so many frequencies all over. And I have to believe that there are a lot of people with symptoms that haven't connected the dots yet. Putting 5G on telephone poles every 300 feet, whatever it is, putting it outside anybody's window, you are putting them in jeopardy of losing their health. You're putting them in jeopardy of losing their livelihood. And I have to ask you, would you want these oscillations, modulations, 24 hours, 7 days a week outside your window?
All right, thank you, Lori. Thank you very much.
And my speech is about the VC County Star article about the Thousand Oaks 5G webpage. And you wanted to correct some public information in that page, when in fact, the webpage's intent, sorry to say, is to mislead, which is dishonest fake news and propaganda. It's misinformation when the city says it wants the residents to have the facts that these FCC rules apply to every city in the country, and they are the law. The reality is that there is no congressional act, i.e. law, that compels any city to accept wireless technologies. Title 47 is administrative rules for the FTC to regulate telecom companies who wish to get their licensure and authority to sell and distribute internet, cable, and telephone services to America. Title 47 is not codified into law of the United States Code, which means this law does not exist. Therefore, no city in America is required to accept its provisions. All the experts are making incorrect arguments. It is misinformation in your attempt to pacify by saying that Thousand Oaks is one of the named parties in a federal lawsuit challenging the new FCC rules. The reality is that this is not a lawsuit or a class action. It is an administrative proceeding in the Ninth Circuit Court. Why are these cities on the docket? They lack standing, they are not a telecom company, and should not be in that venue making an argument whatsoever. It is total insanity, and it is set up to fail. Your FAQ, there's a disinformation when you say that other cities' ordinances are not stronger than yours. The reality is they do exist. There are stronger ordinances. Some cities, for example, in Marin County, they use discretionary versus ministerial decision-making. They have significant differences in distances and setback between poles and exclusion from residential zones. You disinform by omission to exclude links to established science showing clear evidence of cancer, et cetera. I'm going to be submitting into public record evidence of cancer in Ripon School, in which several students and teachers got cancer as soon as the cell tower was installed. And instead, you used tobacco, the tobacco playbook's doubt, and said, wireless industry says such concerns are unfounded. I say, shame on you. After all of our public comments talking about
Thank you, Judy.
evidence.
Your time's expired.
The FCC order is a dead elephant, and the cities are sovereign, and your hands
Thank
are
you.
not tied. Thank you.
Next up, we have Gina, followed by Rose Castro. Gina? No? Okay, Rose Castro, followed by Dana.
Good evening, council members. My name is Rose Castro, and I live in Newbury Park, California. I'm here to talk about the opioid epidemic, which has made its way into our city, our neighborhoods, and our schools. I'm talking about this unpleasant subject, not to be an alarmist or to disparage our beautiful city, but in the hopes of saving even one life. In 2016, there were 116 fatal drug overdoses here in Ventura County. In 2017, there were 165, and in 2018, there were 170 lives lost to overdoses. Based upon this trend, we can expect this number to increase in 2019. These numbers represent those who have died and do not include the overdoses in which the patient survived. My son Jeremy was one of those statistics. In April of 2017, he died of a fentanyl overdose at 26 years old. The police investigation determined that he purchased this drug from someone who lived just a few blocks away from us. I later learned the cost of this drug deal. It was $20. In the opiate world, it takes a mere $20 to take a human life. I shudder to think how many teenagers in Thousand Oaks, Westlake, or Newbury Park who are walking around with $20 in their pocket. For this reason, I believe that opiate awareness needs to be raised in our community by our local government, school district, and law enforcement. I would welcome the opportunity to work with you on any of these issues. In the days following Jeremy's passing, I had 5 other families confide that they too were dealing with drug addiction in their homes. So while people don't openly talk about this painful issue, it definitely exists in our town. Addiction has no boundaries as to who it claims. Our family has started a nonprofit foundation in Jeremy's name to help those in our community who are struggling with opiate and heroin addiction. We aim to rid the stigma, shame, and judgment associated with drug addiction and encourage people to come forward and seek help with their battle. Our mission is to ensure that no other family in the Conejo Valley suffers the loss of a child or sibling due to the opiate epidemic. Anybody wanting more information on our cause can visit us at jeremycastrofoundation.org. Thank you for your time.
Thank you, Rose. Next up, Dana, followed by Alex Valadez.
Good evening. My name is Dana, and I've been a resident of Westlake for 15 years. 2 years ago, Verizon came to my building where I have my office, and they put in 2 huge cell phone towers the size of a Hummer vehicle. And I watched them dig up the ground right next to where I sit, and they put in a ton of cabling going down underground and these 2 giant Hummer-like boxes on the roof. I was scared about it, but I really didn't know what the effects would be. And I'm here to tell you that I'm a very intelligent person. I'm very creative, and I've lost so many of these wonderful things about myself. You can see I'm struggling a little bit to exactly tell you, but I used to be a person who came home every night and cooked dinner for my husband. I didn't order out. I can't even figure out how to cook now. I have problems remembering what the recipes were that I cooked. I don't know how to put things together when I'm trying to talk to people anymore. I used to be creative, and I made a lot of things. I made handbags, I made bracelets, I made jewelry. I made animals, stuffed animals and things. I look at these things and I don't even know how I used to do it. I have nausea on a daily basis. I have headaches. I don't feel well. I've turned into an old woman overnight, and I'm embarrassed to tell my husband that I don't want to do things because I don't feel good. And I really didn't know what it was, but now I'm putting 2 and 2 together because the time frame that I've digressed is about 1.5 years. And that's really not unacceptable. This is not even 5G. I'm being exposed to just Wi-Fi and overhead cell phone towers. So that means signals are constantly bouncing off of our building, which means off of me. I would come home sometimes from work, and I felt so bad, I would lay on the bed, open everything, put the air on, and I would end up throwing up. The nausea is so bad. I have a lot of memory problems and blurry vision, and I didn't even know who to reach out to for help. So this week I found someone that I'm going to be going to be evaluated on EMF sensitivity. But please, it's a real thing. People are experiencing this, and I think, like the second speaker said, they just don't know. Please do something.
Thank you, Dana.
Thank you.
Our next speaker is Alex Valadez, followed by Christy Turner.
Hi, I live in Newbury Park, and I'm also electrohypersensitive, as 2 of the previous speakers were. And I'm also here to talk about the way that it affects, electrohypersensitivity affects my life and others' life, and how 5G could impact that. So in my case, I suffer from severe headaches, chest pains, anxiety, poor sleep, fatigue, heart palpitations, nausea, and among other things. And these are common symptoms for people who suffer from electrohypersensitivity. And it has affected me in my ability to continue my academic studies, my ability to work, my ability to socialize, and in short, it has destroyed a lot of aspects of my life. And I think it's destroyed to a great degree the quality of my life. And with the installation of 5G, I think things would become a lot more difficult for electrohypersensitives, and a lot of us would probably have to move out of Thousand Oaks and either become homeless or something along those lines, because there's not really anywhere we can turn to. So I think it is important to keep in mind that there's a portion of the population that's, even though it's minor, that will be affected severely with the installation of 5G. And a couple of other points I wanted to make about electrohypersensitivity is that in Sweden, it actually is officially recognized as a functional disability, so that the government there makes accommodations for electrohypersensitives by reducing levels of electromagnetic fields in their work environment and the home environment. So that's something very important, I think, to recognize that other countries are taking action. And there have been multiple cases of reliable people, it's been documented, who are electrohypersensitive. For example, Gro Harlem Brundtland, the former Prime Minister of Norway and Director General of the World Health Organization. And there are high quality peer-reviewed scientific studies showing that electrohypersensitivity is a genuine condition. And there are hundreds of scientists around the world who dedicate their lives to studying this, who think that it's a genuine condition. So given this, I'd like to ask if you're confident that this unnecessary 5G experiment that will permit us to download Netflix movies at faster speeds wouldn't be seriously harming the people of Thousand Oaks.
Thank you, Alex. Next, we have Christy Turner, followed by Mandy Jacob.
Christy Turner, Thousand Oaks. I know it's tough for people to share their personal stories of EMF sensitivity, but I think we need to support one another so we can feel comfortable talking about it so others can be aware. How someone is affected is determined first by their susceptibility and exposure. I always remember being sensitive as a kid. I remember going to the valley and being able to smell the pollution. I worked for 10 years as a dental assistant while attending college in the field of nutrition. I was exposed to radiation from the X-rays and tons of chemicals, along with hepatitis and chickenpox vaccines. Shortly after, my digestion and immune system shut down, and I was hospitalized. Then we were introduced to cell phones and laptop computers, followed by Wi-Fi. I've had a cell phone for 19 years now, and for years, both laptops with wireless has caused me to feel a deep dull pain in my bones. My fingers will get zapped. I have flu-like symptoms, itchy red arms, sharp pains in my breasts, the feeling of ants crawling on my arms and face, and an overall just kind of buzzy feeling with confusion. Last year, while driving on the 101 freeway, I blacked out, losing complete vision seconds after my Bluetooth was triggered. I was rushed to the ER to find nothing was wrong. 6 months later, I had an episode of a major heart palpitation, followed by the loss of my breath after texting for 20 minutes. The doctors are telling people they have anxiety, and people don't feel comfortable opening up. What are we supposed to do? What's going to happen to these young children who are going to have a super high susceptibility from already being exposed to enormous amounts of toxins and vaccines? How will they adapt? I just can't wrap my head around the seriousness of this all and how we have to stand here and all fight for our lives. I'm begging you to please do all you can to halt the 5G and infrastructure. Thank you.
Thank you, Christy. Mandy Jacob, followed by Kim Payne.
Good evening, City Council. I'm here tonight to formally introduce...
City of residence, please, Mandy.
Newbury Park. Newbury
Thank
Park. To formally introduce our organization. My name is Mandy Jacob from Newbury Park, and I'm the president of Ventura County Issues Reform. As the name states, some people refer to it as VCIR, and you can go to vcir.net, but as the name states, we are a local advocacy group that supports residents in issues pertaining to Ventura County. And as you know, we've been coming here for a few months now regarding 5G. And funnily enough, we're going to change our name pretty soon to California Issues Reform because we've had so many counties come to us to help them. So we are now helping Santa Barbara County, Inland Empire, and San Diego County. But we were also recently contacted by a group in Los Angeles County that are as they term it, microwave sick or EMF sensitive. And that term was actually coined all the way back in World War II. But as we know, electromagnetic field sensitivity is now referred to by the scientists and doctors and is acknowledged by the ADA, American Disabilities Act, and the United States Access Board. You may or may not know that the mayor gave us his facility to host the world-famous Daphne Tachova from Israel, who fought up to the Supreme Court and managed to remove Wi-Fi from the schools there. And we had over 170 people with standing room only for over 4 hours. In between our last city council meeting and that city council meeting, we have met with the mayors of Calabasas, Camarillo, Agora, Santa Barbara, and Burbank. And there's a growing realization within those meetings that they can do things with the small cell facilities within the FCC guidelines while they are maintaining their control and safeguarding their residents. Also, we're always wanting to work with you and tell you about all the different colorful solutions they've come up with. We also went and met with Congresswoman Brownlee for the second time now, and we want to thank you for sending that letter that Rob McCoy did on behalf of the city. They were much more amicable to us, so that helped a lot, and now they have signed on to HR 530, so we thank you for that. That's fantastic news for us. Besides Congresswoman Brownlee, we had a one-on-one with Katie Hill, and then we had 2 town halls with Jackie Irwin. Unfortunately, they keep referring us back to you, which is why we keep coming back. But Westlake Village City Council managed to have a meeting with Senator Stern, and we just thank them for representing their residents.
Thank you, Mandy. Thank you.
May I just ask you, we didn't bring all our speakers tonight just so that I could let you know what we've done on the Congress and Senate level. I've got 2 more paragraphs.
You could submit it to the city clerk. We'll take a look at it.
Really?
But your time has expired. I'm sorry.
You would have had to sit for at least another half an hour. I would have thought out of respect for the new organization you would like to hear from us. Thank you for your time.
Thank you, Mandy. Next up, Kim Payne, followed by Dr. Carol Tessetta. Kim? Not here? Oh, all right, very good. And then we have Dr. Carol Tessetta. I hope I pronounced that correctly. Good evening.
Hi, good evening, council members and audience. I'm Dr. Carol Tessetta, Newbury Park. I'm a board-certified licensed physician. I'd like to present an informed consent form that, if I worked for the telecom industry, they might have me write, and it might look something like this. You have been volunteered to take part in a clinical trial for healthy subjects and patients with microwave sickness, coded in ICD, exposure to other non-ionizing radiation, microwave. Just last week, on June 18th, the ICD-11 coding came out, and these codes you might choose to include are assault by exposure to non-ionizing radiation, exposure to non-ionizing radiation with undetermined intent, and unintentional exposure to non-ionizing radiation. This clinical trial excuse me, uses an investigational device called 5G. 5G has not been approved by the FDA in the United States. The investigational device 5G is being studied to provide digital opportunity for all Americans. Side effects will not be studied in this trial. We didn't bother making a form which would tell you about the risks and benefits of this clinical trial and what will happen if you choose to take part, which is not an option. You will not be assigned a study doctor who would have explained the clinical trial to you. You will not be able to ask questions. You will not be able to decide whether or not you agree or disagree to be part of this research trial. You will not enjoy the process known as informed consent. In addition to this clinical trial, there are other options you could consider. You could move from Thousand Oaks. Prior human studies with 5G. Although 5G has been studied for military weapon and some medical applications in humans, such as laser surgery, this research study is the first using 5G in the general population, including children, pregnant, and breastfeeding women. How many people will take part in this study? Everybody. However, some will be lucky enough to sleep far away from small, small cell towers. For example, those with a lot of acreage on their property. You will not be asked to monitor any symptoms by anyone. There is no screening for eligibility. You're automatically eligible no matter what your medical condition. How long will I be in the study? Maybe forever. Can I stop being in the study? No. What side effects or risks can I expect from being in the study? Certain side effects and discomforts of 5G may happen. You may have all, some, or none of the known side effects. There is also a risk that rare or unknown side effects may occur. Effects may go away soon after 5G is stopped, but in some cases, side effects may be serious, long-lasting, or permanent, such as cancer, congestive heart failure, neuropsychiatric effects, and cardiomyopathy.
Thank you, doctor. Thank you very much.